Hello everyone, hope all of you are fine. In this lecture, we will study about autogenic drainage. Autogenic drainage is a technique of airway clearance in which patients first breathe at different lung volumes and then forcefully expire to throw the mucus out. This is the definition of autogenic drainage. There are three phases of autogenic drainage. Number one is unstick phase, number two is collect phase, and number third one is evacuate. In unstick phase, patient breathe on low lung volumes and then mucus mobilizes from distal airways to mid airways. In the second phase, which is collect phase, in collect phase, patient breathe on tidal volume and then mucus that comes from distal airways to mid airways is then collected into the central airways. And the third phase of autogenic drainage is evacuate. In evacuate, mucus accumulated is evacuated through huff, but the cough is encouraged or discouraged in autogenic drainage technique. So in the phase of evacuation, mucus accumulated is evacuated through huff and the mucus comes out. Cough is discouraged in autogenic drainage. Now we will discuss about modified autogenic drainage. In modified autogenic drainage, there is a phase of in autogenic drainage there is a phase of unstick in which patient breathe on low volume, which is very uncomfortable for the patient. But in modified autogenic drainage, the phase of unstick is not present. There are only two phases in modified autogenic drainage, which are collect and evacuate. Patient breathes on tidal volume, and when patient breathes on tidal volume, after inspiration of each breath, he holds for 3 seconds and then next phase starts. Unstick is not present in modified autogenic drainage. Modified autogenic drainage is performed twice a day, 30 to 45 minutes, and it is done in sitting positions. These all techniques are for airway clearance because in bedridden patients mucus is accumulated and their lungs are compromised. In that patients we have to do airway clearance so that their tidal volume remains intact. In abdominal surgery, cough is discouraged because cough increases the abdominal pressure. Now we will discuss about PEP. PEP stands for positive expiratory pressure. Positive expiratory pressure is given through apparatus called PEP mask. Patient is in sitting position. Patient is lean forward and elbows are held on table. Patient is wearing in mask and patient puts his one hand or both hands around the mask to seal the mask, and the mask acts as a one-way valve. It allows only air to come in and doesn't allow air to come out. Further, we will discuss about positive expiratory pressure in the next lecture. Thank you for watching my video.